Surgical pathology. To our students, the points of discussion mentioned in this presentation are examples of discussion in examinations. The discussion in examination is not restricted to the points mentioned in this presentation. Discussion of a jar. Identify the anatomical part of the jar. Describe the gross macroscopic pathology. You should know well the pathogenesis of the disease. Differential diagnosis. Symptoms and signs, investigations, complications, diagnosis, and treatment. Duodenal ulcer. The first part of duodenum, an oval ulcer. A jar containing the distal part of the stomach and the first part of the duodenum. The latter is the set of an oval ulcer which reaches the muscle coat and the serosa. The ulcer edge is sloping, the floor is smooth, and is composed of a layer of granulation tissue. Examples of point of discussion. Types of peptic ulcer, differences of gastric and duodenal ulcers, peptic ulcer and malignant change, differences of ulcers at the greater or lesser curvature of the stomach, types of dyspepsia in peptic ulcer, and body weight. These are amoebic ulcer in the colon. A jar containing a part of the large intestine. The mucous membrane is exposed. There are multiple variable-sized flask-shaped ulcers. They are irregular, rounded, or oval. They have undermined edge, yellow necrotic floor, and the base is mainly formed of muscle layers. The ulcers are shaggy and shreddy, but the mucosa in between is healthy. A jar containing a specimen of the large intestine. A jar containing a part of the colon which is cut longitudinally, showing multiple polypi in the lumen. The mucosa is partially ulcerated. The pericolic tissue shows extensive fibrosis with tiny tubercles. The muscle coat of the colon is continuous, not interrupted. The longitudinal muscle is not interrupted. The pericolic tissue is thickened and shows minute calcifications due to deposition of large number of Bilharzia ova. Enlarged some local lymph nodes. Another jar of the large intestine showing multiple polypi. A jar containing a part of the large intestine. The lumen shows multiple polypi. The polypi are sessile and pedunculated, covered by ulcerated mucosa. There is no interruption of the muscle layer. This means it is not malignant. Jar containing large gut with polyposis also. Example of points of discussion. Types and causes of gut polypi, differences between true and pseudo polypi, polyposis and malignant changes, types of bilharzial infestation, hematobium or Mansoni, and malignant change. Jar containing the vermiform appendix. It is constricted in its middle. Distal to the obstruction, the appendix is swollen, edematous, and covered by inflammatory straw-colored areas of suppuration and black areas of gangrene are present. Obstructive appendicitis. Examples of point of discussion: differences between obstructive and non-obstructive appendicitis, neoplasms of the appendix, differences between the appendix and the Meckel's diverticulum, acute appendicitis with pregnancy. Jar containing a gut with mass and enlarged lymph nodes. A jar containing part of the cecum, appendix, and terminal ileum. There is a cauliflower mass projecting from the lumen of the cecum and invading the wall. The surface of the mass is necrotic and hemorrhagic. The muscle layer is interrupted by the infiltrating tumor tissue. The paracecal lymph nodes are affected. A jar containing a part of the large intestine opened longitudinally. The muscle layer is interrupted by a stricture due to a tumor that has destroyed the wall. The lumen is narrowed in some part and is completely obstructed by the tumor in other parts. A jar containing a part of the cecum and anal canal. There is an ulcerative malignant tumor mass in the lumen of the rectum invading the wall. The edges of the ulcer The edge of the ulcer is everted and the muscle layer is interrupted and lost. Examples of points of discussion: macroscopic types of cancer colon, differences between right and left side colonic carcinoma. A jar containing a gallbladder with thick wall. It is slightly enlarged. Stones are present at the fundus and the neck of the gallbladder. The stones are numerous, dark brown in color with faceted surfaces. A jar containing a gallbladder with a thick wall and dark brown color. It contains large stones, most probably cholesterol stones. There are also multiple small sized stones. A jar containing a hugely dilated gallbladder with a thick wall. A window is made at the region of the neck to show two large oval stones. Examples on discussion: types of gallstones and complications of gallstones. A breast sample. A jar containing a breast specimen. The cut surface shows a grayish-white rounded mass. The skin shows pod-orange appearance. It shows local infiltration, affection of the regional lymph nodes. A jar containing a breast specimen. The cut surface shows a grayish-white round mass. It infiltrates the whole breast tissue. Examples of points of discussion: the microscopic types of breast cancer, the clinical picture types of breast cancer, the staging of breast cancer, differentiate a postmortem from a surgical breast specimen. Goiter. A jar containing both lobes and the isthmus of an enlarged thyroid gland. The outer surface is nodular and the nodules are variable in size. The cut surface shows multiple nodules varying from 1 to 5 centimeters in diameter. Each nodule is surrounded by whitish fibrous tissue fibrosis. Some of the nodules contain colloid and hemorrhage. A jar containing both lobes of an enlarged thyroid gland. The outer surface is nodular and the nodules are variable in size. The cut surface shows multiple nodules varying from 1 to 5 centimeters in diameter. Each nodule is surrounded by whitish fibrous tissue. Some of the nodules contain colloid. A jar containing a piece of the thyroid gland in the form of a single nodule about 3.5 centimeters in diameter. There is an area of calcification. There is a small nodule encircled by the fibrous tissue. A jar containing a lymph node cut into two halves. It is affected by tuberculosis. The cut surface shows multiple pale yellow caseous foci matted together due to spread of tuberculous infection. A jar containing a slice of the spleen. The spleen is enlarged. The outer and cut surfaces show numerous gray nodules measuring up to 8 millimeters in diameter. Good luck and best wishes.